Hello. Good evening, fellow friends and loved ones. Yes, it's once again a very great privilege to come to your homes this wonderful evening, the 14th of February. Yes, we've entered the second week. In fact, we've in the second week of the month of February, and we are very grateful. Today is a special day. Yes, it's a Valentine's Day, and I'm sure we all had a wonderful time at church, and I'm sure some of us are also still having some wonderful time enjoying ourselves. But then, in the enjoyment process, we also want to learn something small from our weekly discussions that we planned on. Yes, so today is also another very important discussion, and even in this season of this pandemic, it's necessary that we talk about this condition. Yes, so before we begin this presentation, we bring it in the name of the Father and the Son and the Holy Spirit. In Jesus' name, amen. Okay, so thank you very much. And so we begin this presentation. We acknowledge all who are watching, who are about to watch, for your time and for everything that, and your data especially. Yes. So, and we're going to, these are outline, the quote, the definition of the condition, or the description, the anatomy, the causes, the symptoms, and how we diagnose this condition, the types of the condition, and then the treatment of this condition. Then after that, we'll talk about our next topic. Yes, I'm sure we'll learn a lot from today's discussion, and then we'll be able to share it among our friends and our loved ones. Okay, so today's condition is actually an interesting one, as you said earlier on. It's termed fluid in the lungs, or or the layman will say water in the lungs. So the first one is called pleural effusion. So scientific name will term it pleural effusion, or the layman will say water in the lungs. So we have a description of the process where we have so many causes of causing water in the lungs. Before we talk about the causes and the symptoms, we just want to look at the anatomy, how it presents itself in the body. So when you look at the body, we have structures we call lungs, 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 that are found at two very important places in our body, our chest. So we have one lung here and one lung here. This is my right. Okay, so the video is to my left, but to my side is my right. So your right, you have one lung here, and then you have another lung here, and they are like balloons that are in our body. And these lungs that are balloon-like structures help to absorb air. So when you breathe in, the air goes into the nostrils and to a place we call the larynx, and it goes into the bronchioles. It goes in the bronchioles. They are all tiny structures, and then finally it goes into the lungs. And these balloon structures have structures around it we call capillaries that absorb the air, the oxygen in the air, into our system and then straight into our bloodstreams. Then they are sent into circulation, and then we are able to have our systems, our eyes, our nose, our ears activated, and we can move movements. So as I'm moving like this, there's supposed to be enough air and oxygen in the lungs to help me do this function. Okay, so when you talk about these lungs, in anatomy you call something structures. They are very important. So the right lung has three different parts. Yes, three different parts. So we have the upper lobe, that is the superior lobe, the middle lobe, and then the inferior lobe. And then the left lung has two lobes, the superior and the inferior lobe. And these three lobes, so if this is the lung like this, we have another one that sits under it, another one that sits under it. So they all take in the air that we breathe, and then they take in the oxygen from the air, and then they send it to our heart so that our heart can pump good blood, and then very good blood. Okay, so the right lung has three different lobes, and the left lung has three different lobes, so that they can take in the air and then they send into the heart. But in this lung, we have a structure we call pleural space. So if you have the balloon like this, under the balloon there's supposed to be a space that will prevent it from having contact with the bones. Okay, so it's called the pleural space. The pleural space. And this space is where we have something we call fluid, called the visceral fluid. Yes, the pleural space. We have the pleural fluid in that space. So we have the balloon there, and then we have the space there, and before we have the bones. Yes, so we have this very important structure called the visceral pleura and then the parietal pleura. These are all anatomy. I'm sure you are a bit wondering how, and then this thing you're just having a wonder. So we have two spaces called the visceral pleura and the parietal pleura. The visceral pleura is attached to the balloon, the lung, and then just under the visceral pleura we have the parietal pleura. Yes, so this parietal pleura, in between the visceral pleura and the parietal pleura, there's a space where you have fluid inside, so it prevents the interaction between the lungs and then the bones or beneath structures from the lungs. So this structure is called the pleural cavity. Pleural cavity. And when this structure has fluid inside, it helps for the lung to be able to survive, and then we can breathe well, and then we have good function of the system. But in the case where we have this condition called pleural effusion, there is excess fluid. Yes, excess fluid within this space, and this fluid can be so much such that it could narrow the space the lung is supposed to carry. So if the lung is supposed to carry this space, if the fluid is too much under the space, that's the balloon, it shifts the lung up and then causes smaller balloonness. That's the lung space. Therefore, we can't breathe well. So when some people have this condition, we're talking about some symptoms. They can't breathe well. There are so many symptoms of this condition. We're talking about it very soon. And so this fluid becomes extra and excess in it because we've tampered with the space. Immediately we tamper with that space, it causes overproduction of this fluid called the serous fluid. Yes, and so you have too much production, and when you have too much production, then you have to remove some of them because there's a particular amount of fluid that has to be in that space, and scientifically it's proven that 0.3% of that fluid is supposed to be in that space. So then we have to go through maybe other means. You have to go through surgery, most of the time surgery, to go to remove the fluid and then ensure that there's enough fluid in the system. Okay, so as we said, there are so many times, so many instances where we can mention this condition. So we can have people call it fluid in the lungs, some people call it water in the lungs. And so we've mentioned this structure called the pleural cavity in between the lungs and then the bones. Yes, so we have the lungs here, and under it we have a structure we call the rib cage. So the rib cage, this is our rib cage. So inside here, the bone here is our lungs, because we can't expose our lungs to the environment or to the outside. So the bones here, we have the rib here, it protects us from having direct contact. When you blow me like this, it don't hit my lung, it hits my chest. But when you blow me, give me a heavy blow, it can affect my lung. Okay, so we will talk about some of the causes of this condition called pleural effusion, also known as water in the lungs. Okay, so some of the causes include infection. Yes, we can have infection, and it could be also trauma, that is a blow, when you have blow to the chest area. So mainly you could have infection and then trauma. There could also be a heart failure. So when you have a heart failure, yes, when you have a heart failure, there could be a pleural effusion. That is, could have extra amount of fluid just under the lungs and this could cause so many problems. There could also be pulmonary embolism. So if you have a clot around your lung region, if you have a clot around the side, you can notice through various tests. You can have an MRI taken and we can see the lungs, and you can diagnose someone having pulmonary embolism. You could have after surgery, after an open heart surgery. So when someone goes through an open heart surgery, the person could have pleural effusion after the surgery. There are so many types. If someone has cancer too, the cancer could affect the lung. So you have cancer of the lung, and the person could have pleural effusion, that is fluid in the lungs. Okay, so let's take note and let's look at some statistics of this condition. So in the United States of America, that is the US, he says that about 100% of 100,000 cases are diagnosed yearly. 100,000 cases are diagnosed of this condition. And we have two main types of this condition. We have the exudative pleural effusion and we have the transudative pleural effusion. Okay, so in the first type, we could have excess amount of fluid around the chest area, but then it could be more of protein rich. So we have proteins in the fluid. So if you have proteins in the fluid, then you could say that the person has pleural effusion being exudative. Okay, and the second one is transudative. So transudative is actually less amount of protein. So we have actually no protein in the fluid. Okay, so some examples of the exudative, that's the protein in the fluid around the lungs, is one. You can have pneumonia. So if you have pneumonia, there could be proteins in the fluid around your lungs area, that is the pleural cavity, the space under the lung called the pleural cavity. There could be if you have pneumonia, if you have cancer, if you have kidney problems. So kidney, where your body is not able to absorb enough nutrients out of the blood, you could also have pleural effusion as a result. There could also be infections. You could have inflammatory diseases. And then the other type of the pleural effusion, which is transudative, is where you could have an open heart surgery. So after an open heart surgery, there could be no puncture or any injury or infection, but then there could be probably a puncture to the region around the lungs, and this could cause pleural effusion, that is extra amount of fluid in the lungs. And then we could have so many processes to drain the fluid, which we'll be talking about very soon. Okay, and then there could be also liver cirrhosis. So when you have a condition called liver cirrhosis, that a condition that affects the liver, it could indirectly or directly affect the lungs, and this could result in pleural effusion. Okay, so it says that normally there's supposed to be a small amount of fluid in the lungs, that is just under the lungs, to allow the lungs to move very well. Because if there's no fluid, then I mentioned that it's a balloon-like structure, so there'll be friction. Helps to prevent friction, yes, in the lungs, and so we have a very normal function of the lungs. Okay, so some of the other causes of the condition called pleural effusion is one, tuberculosis. So if you have tuberculosis, you could have pleural effusion, that is extra amount of fluid in the lungs, and then surgically you'll be forced or you'll be asked to go for a surgery, a minimal surgery or a major surgery, to be able to move the fluid from the lung. We could have also autoimmune diseases such as systemic lupus erythematosus. So these are scientific. You could have rheumatoid arthritis, that is general pains, body pains, and could have ovarian hyperstimulation syndrome, that is mostly in females or in females. And if you also have trauma to the chest, so if someone blows you at this area, it could affect or it could injure your lungs, and this could temper in the amount of fluid that's supposed to be in the pleural space, that is under the lungs, the space under the lungs. If there's too much fluid under the lungs, this could be also an emergency which has to be drained off. Other than that, your lungs could collapse or your lungs could be destroyed, and I don't think you will to survive and function well. Moreover, if we have two distraction of your lungs, I don't think you can survive. So it's a matter of an emergency. And also we could have so many conditions such as accidental infusion of fluid. So if the doctor or the surgeon tries to push in fluids around the chest region, there could be a puncture into that space and there could be overproduction of that fluid. Okay, so how do we diagnose this condition? Yes. Okay, sorry. Okay, so yes, we are talking about the how to diagnose this condition. So yes, we could use an X-ray, yes, a chest X-ray. So you go to the radiographer and then you take a picture of your chest, and then when you look at your chest, it could be extra amount of fluid in the chest area. So around this region, when you take an X-ray, there could be too much fluid, and the way you can notice that there is too much fluid, that actually with an X-ray you're supposed to see the fluid being the chest having a darkish region. So when the X-ray hits your chest region, it gives a reflection of a dark region. So in the midst where you have a whitish region around this area or around this area, then it could mean that there could be a foreign body inside, and mostly a amount of fluid around your chest region. And so then you are taken through a surgery to go to drain the fluid. So, and also we could use ultrasound, and then there could be a process called thoracocentesis. That is there could be a needle injection. So they use a needle to pull amount of blood there, or to pull amount of fluid there, and that fluid is taken to the laboratory, and then to check whether there are other infections or the other causes of this extra amount of fluid. So if they see and there's a cancer in the cancer cells in the fluid, then it's treated as such as probably a cancer or malignant condition. Okay, there's also another process of diagnosing the condition called the video assisted thoracoscopy surgery. Yes, so actually it's performed under general anesthesia. So this is actually one way of treating this condition, which we'll be talking about very soon, and how it's done. Okay, so we mentioned chest X-ray. You could use CT scan, so they give us a very good picture of the chest region. So if you have quite whitish area around your lower chest region, then it could mean that there's some amount of fluid in the chest. So after surgery, that is after an open heart surgery, the doctors mostly look for this because there's a very high likelihood that there could be fluid in the lungs, and when it's drained, then the person or the patient returns to normal function. Okay, so after diagnosing this condition, so how do we treat this condition? Okay, so it's mainly treated by surgery. So mainly treated by surgery because it's important that the fluid is brought out of the chest region, because if there's too much fluid in the chest region, there could be collapse of the lung could be destroyed, and you can't breathe through that side of the lung. So surgery, we go through, there are two main processes of the surgery that we go through. The first is the video assisted thoracoscopy surgery, and actually this is minimally invasive, and this is used to manage conditions that are actually due to cancer. So we don't want to go through the chest region or the back to cause other damage to other structures. And so this is actually video assisted. So they just go through with the device to be able to remove the fluid there, so the person can have enough air space to breathe in. Also, we have the surgical procedure that we call the thoracotomy. So this is called also traditional open thoracic surgery. So they cut around the chest region, and then they try to drain the fluid, and then ensure that as time goes on, there's a very consistent or constant amount of fluid. That's about 0.3 milliliters of the fluid in the lungs, and so the person now returns to normal function. So after the thoracotomy, the doctors or the surgeon puts a tube in the chest region, so mostly the lateral region, so that the fluid can drain. So the normal thing is that the body is supposed to produce the fluid in the chest constantly, but when there's overproduction, the body is not able to survive and the lungs not able to survive. So the doctors or the surgeon remove this fluid through the chest tube, and after some time, after about 2 days to 2 weeks, yes, the fluid is supposed to drain all down, and then the person returns to normal function. Aside this, actually, physical therapists also come to play a very important role to be able to ensure that, yes, this fluid comes out very efficiently and in the right time, because when they stay too much in the lungs, they're also going to cause too much problem. So what is the role of physiotherapy in this condition? So after surgery, or when the condition is diagnosed, that is the pleural effusion, a physiotherapist comes in place to be able to drain the fluid out of this cavity that we mentioned. So the cavity is around the side. So you have the two lungs here, and you have the cavity just under the lungs, the balloon-like structure. So the chest tube through the surgery is put in the chest area, and then you connect it to a draining tube. Then the physiotherapists come to play. So we have various exercises that we go through. The first and most important exercise is the using of an incentive spirometer. So it's a device that helps to open up the lungs. Incentive spirometer. So it's like a straw. It's like a straw. After the presentation, there'll be so many pictures to go to explain this device. Yes, called an incentive spirometer. And so we hold a straw like this. It's like a straw, and then there's like a container in front, and there's a ball. Sometimes some of them has 3 balls inside to measure and to be able to quantify the amount of air you've taken in as time goes on, so that we can evaluate how effective you are doing it. So the patient takes in the straw like this and sucks in. So it takes in the air into the lung for lungs to open up. So as the patient is taking the air as constantly as possible, the lungs open up. So as the lung is opening up, then it's pushing the fluid out. So lungs open up and then increase the space in the chest region and pushes the fluid out. So opens up and pushes the fluid out, and this helps to return to normal function of the lungs, and this helps to prevent the lungs from collapsing. Yes, this is very, very important. Okay, so aside this device called the incentive spirometer, we have other exercises such as breathing exercises. So you're taking a deep breath, so as often as possible. Then we have another exercise we call the active breathing exercises, or active assisted cough exercises. So the patient breathes in and coughs out like this. So as it coughs out, it opens up the lungs and pushes the fluid out of the body into the drainage tube. So when this is done, there is a daily monitoring of the amount of fluid in the lungs. So if the drainage of the fluid is constant, which is about 0.3 milliliter, then after 2 days to 2 weeks, then the tube is taken off. It could be earlier, that is 2 days or more, but less than 2 weeks. So when this is taken off, the patient is free, and then the chest region is sealed. Aside this breathing and active cough exercises or assisted cough exercises, there are also an exercise or a technique we call cupping, shaking, vibration. They are all massage techniques. And so we have shaking, that we shake the patient's chest. So we shake the patient's chest like this. Yes, so that the fluid can fall out and be moved out of the system. We also have cupping, so we hit the chest like this, and the back to like that. So this helps to shake the lungs and push the fluid out of the system. Yes, and then we also have vibration. Yes, we shake the patient, and then this helps to also drain the fluid out of the system. So we're talking about the condition pleural effusion. That is when we have fluid or water in the lungs, and some of the physical therapy or the exercises that as professionals we do to remove the fluid. We talk about the surgery. That is the first one, that is the VATS, the video assisted thoracoscopy. Okay, video assisted thoracoscopy surgery, and then the second one is the thoracotomy. That's the last one, the very invasive one. Then the physical therapy, and also very importantly, after some few hours, if the patient can sit up and then start standing and walking, is very important. And as the person becomes active, it also helps to allow the lungs to expand, because then the lungs will put to work. So it's very important that immediately after this surgery is done, yes, the patient resumes to activity as early as possible. Okay, so these are some of the exercises that as physiotherapists we do. There are functional exercises that also we do, such as picking, or lifting up like this. So functional exercise, to pick something from the top there as you are raising your hands up like this. This helps also to be able to ensure that there is enough fluid drainage out of the lungs, that's just under the lungs, to be able to ensure that our lungs can perform its function of taking in air as best as possible. Okay, so aside that too, we have a very important protocol, that is assurance and then reassurance, because some people who have worst of these conditions need to be encouraged that yes, sometimes it will take quite a longer time for the fluids to drain out fully, or for all to drain out. Some of them have psychological problems, and then therefore they feel bad that yes, they've been in the hospital for a week and then the fluid hasn't still come out. So as physiotherapists also, we reassure the patient that yes, it will take time, but then the fluids will come out of the system. Okay, so we've talked about the condition pleural effusion, the causes, yes, and being the fact that in the US about 100,000 cases are recorded yearly. Even in some other researches, it is stated that about 1.5 million cases yearly. I think that's one of the recent study that was conducted. Okay, so I'm sure there's no pictures as of now to go to give us a very good picture of this condition, but on our Facebook wall, that is, so you go on Facebook and search for the name RICH and then KOTEY. I'm sure that you have a very good pictorial presentation of this condition. Yes, so today this marks the end of our presentation. I'm sure that we've had a very good understanding of this condition called pleural effusion, or fluid in the lungs, or water in the lungs. So this condition is very, very important, and there are very, very important points to note. Yes, so we didn't mention about that, but I'm sure we have to come to terms. There are very important symptoms of this condition. If you didn't get anything from the lesson, I'm sure let's get this symptom. If you have chest pain, if you have dry non-productive cough, that is, you cough and you hear some noise at the end like you cough and the cough is dry and you don't bring flames out of your mouth, it could be a symptom of this condition called pleural effusion. If you also have the ability to not to breathe, we call it autopnea. So when you can't breathe, immediately you sit up straight or you stand upright. If you can't breathe well, there's likely that you have this condition called pleural effusion, because the lung would have been narrowed and then there'll be less air entering your system. This could affect circulation and the blood in your body. So if you have chest pain, if you have dry non-productive cough, that is a cough and then you don't feel any flames in your throat, if you have difficulty breathing, that is dyspnea, or you have autopnea, that is when you get up, you feel dizzy, and you're unable to stand very, very, very well. This is a cause for alarm, and so therefore you could have this condition we call pleural effusion. Yes. So this brings us to the end of our presentation for this evening, the 14th of February 2021. I'm sure that we've learned a lot, and we'll be in a very good position to explain to other people for this condition. So this okay, so if you have any question, we can bring on board so we can answer. And other presentation, the previous presentations, or any presentation that concerns health, we could ask, and then we could answer you. Yes. Okay. Okay, so I'm sure we have less questions. Yes. So we talk about the condition called pleural effusion. Okay, so I can see Volino, can see Mr. Dudu, I can see yes other. Okay, yes. So I hope we had a very wonderful time, and then we've learned a lot in this condition. I'm sure the pictures that are not available are setting our minds into a wonder. But after this, we can go onto our Facebook wall, and then the Facebook wall is Rich Kote. If you have any support, you can call us on the line 0540 514092. And then we could be of very, very good help to you. So this is from RICOY Health International Foundation, and we are very at your doorstep to assist you. Yes. Thank you very much for your time. May the Lord be with us all. So the next topic for next week is very, very interesting. I'm sure that with that one we'll have very, very good pictures to be able to give us a very fair idea of this condition. So it's a simple condition, but let's take note of it. It's titled headaches. Headaches. I'm sure most of us have been one way or other affected by this condition, by having headaches. But what causes this headache? Are there types of headaches? We'll discuss in our next topic, our next presentation, our next discussion. Have a blessed evening. May the Lord be with us all. Thank you very much. Bye.